Imaging mapping out an injured or an impaired brain to see what needs to be fixed, and then using magnetic fields to stimulate nerve cells in the brain to help it heal.
Our Paul Drews reports on this non-invasive procedure that some patients undergo in Hawaii. It's a story you'll see only on Island News.
Sherry Ogata, a broker in charge at Better Homes and Gardens Real Estate, dealt with depression for decades.
It was caused by childhood trauma, so, have been dealing with it most of my life and had gone through 30 plus years of therapy, talk therapy, tried various medications, but didn't ever work for me.
She says COVID made her brain fog even worse, and afterwards couldn't shake her symptoms.
You literally feel like there's this black cloud over your head, and I would feel like that all the time. And then there's also a lot of intrusive negative thoughts that come with that, which lead to the anxiety.
This year, she tried something fairly new to Hawaii, transcranial magnetic stimulation, which stimulates parts of the brain that are underactive or calms down parts that are overactive.
The idea is when the cortex, or the top layer of the brain that is largely the regulator of everything you think, feel, and do, is when it's in a disorganized state, that tends to correlate with various symptoms and disorders, including depression, anxiety, and PTSD. And by restoring the balance, people have a tendency to think, feel, focus, and sleep better.
The procedure is FDA approved to treat severe depression, migraine headaches, and obsessive-compulsive disorder, but is also being used to treat other conditions.
What gets me most excited is continuing to treat things that we thought were untreatable before, like concussive brain dysfunction, PTSD. Most of the folks that we treat that have autism can go from severe to mild to moderate, from moderate to mild, and to mild to improve functioning, to the untrained eye, perhaps functioning within the range of normal or neurotypical and functional. So,
after an initial brain mapping to see which parts are over or underactive, each treatment lasts about 30 minutes, where the brain is stimulated by magnetic coils.
Just a little something kind of pulsating into my head, but it doesn't hurt.
Dr. Kiefer says a typical treatment can last 6 to 8 weeks with 40 sessions. For Sherry, those treatments have been life-changing.
My depression is really gone, like for the first time in my entire life. Anxiety is way better. I feel super calm. Yeah, it's been life-changing, really, and my brain fog is a thing of the past now.
We saw restoration and strengthening of brain activity in the frontal areas. Organized, coherent, synchronized brain activity generally predicts improved mood, less anxiety, improved sleep, improved focus, and fortunately that's what we saw in Sherry.
While Sherry and other patients have seen success with this treatment, Dr. Kiefer says 10 to 20% of patients don't end up with a significant improvement in brain function after TMS. And right now, only those 3 FDA-approved treatments are covered by insurance, which means repairing or improving brain function because of other reasons can be costly. Paul Drews, Island News.